Once again, welcome to Africa's first Global Hair Loss Conference, proudly organized by Vinci Hair Clinic Africa. My name is Kemi Oye and I am your host for today. Today's conference promises to be exciting and enlightening. But before we commence our items for today, please note that if you have questions during the course of today's conference, you can drop your questions in the question box. I have seen a couple of questions already, and please be rest assured that we are going to answer all your questions today. If you'd also like to share comments, you can also drop that in the chat box below. We would love for you to take pictures during the course of today's conference and share on your stories, your WhatsApp stories, your Instagram stories, your Twitter feed, using the hashtag Vinci Africa HLAM 2020. We'll take that again. We would love for you to take pictures during the course of the conference, share on your Insta stories, your WhatsApp stories, using the hashtag Vinci Africa HLAM 2020. Moving on, our keynote speaker for today is none other than the CEO, Vinci Hair Clinic Nigeria and Ghana, Mr. Ayo Otubanjo. Ayo Otubanjo is a senior consultant.
Thank you.
Just a minute, Mr. Ayo. I would love to read your profile for the benefit of our attendees. Ayo Otubanjo is a senior consultant with the world's leading specialist hair restoration company, Vinci Hair Clinic, and the regional CEO for Vinci Hair Clinic Africa. As a hair loss consultant, Ayo has consulted with over 2,000 patients experiencing varying forms of hair loss. Thank you so much, Mr. Ayo, for deciding to be our keynote speaker for today. You have the floor.
Thank you very much, Kemi. Thank you very much. I appreciate that. Welcome again, everyone, to our very first hair loss. Welcome to our first Hair Loss Awareness Month special. So, what I would like to do is to share my screen with you first, so you can see where I'm looking at. Good. Okay, so I've got my slides up. Okay, wonderful. So welcome all to our very first ever Hair Loss Awareness Month conference. Thank you very much for that wonderful introduction, Kemi. Thank you. So when we first thought of the idea of setting up the first ever hair restoration clinic in Africa, I mean, which came up in a very innocuous conversation in a London private club, and I'm sure Salva will remember this back in 2013. I do not think we fully realized then how desperately needed our services will be. We tested the market, before we came into Africa, and found the demand was phenomenal. Nearly 7 years later, and after nearly 6 years in operation, we've set up 3 clinics in West Africa so far, 1 in Lagos, 1 in Abuja, and the 3rd and latest one in Accra, with ambitions to open up clinics in other parts of Africa. Now, it is the one question I keep on being asked, when are you going to open up in other places, such as Port Harcourt or Kumasi or Nairobi? People are always curious to see how, when we're going to open somewhere close to them. Well, we do have ambitions, and we will be opening more clinics in due course. But what we have done is we've brought a new medical specialism to the African continent, and that is one thing I'm really proud of. And we've trained our medical staff in an area of medical aesthetics, which is still very new to a vast majority of African medical professionals. Now, there are several myths and misconceptions around hair loss. And I should know, I've heard so many since we started in Africa. And I'm hoping the success of this conference will largely be measured by how many more people become more knowledgeable about this condition and the different types of treatments available to restore hair. You would have seen in our introduction video, did you know that 1 in 2 men and 1 in 4 women will develop a genetic form of hair loss at some stage in their lives? Do you know that nearly 1/3 of African women suffer from a particular condition we call traction alopecia, or more commonly known as loss of edges, mama eko, mama yabo, or chop chop? Take your pick. And finally, do you know that about 52% of women have intimacy issues related to their hair loss? These are just some of the facts that recent research has revealed. These are some of the traction alopecia cases. I mean, you'll be very familiar with some of these pictures that I've brought up. Most African women, you might know somebody that has this particular type of hair loss. It's very common. We see probably 1 out of every 2 female clients that come into the clinic suffers from this condition. In the most extreme cases, it could be even worse than what we saw earlier. You've seen, this is quite an extensive form of hair loss. Okay. And also men do develop what we call the genetic or the male pattern baldness. And you could certainly relate to some of these many within your family unit. Okay. So these are just some of the examples of the hair loss that we attend to in the clinic. When I first started studying and researching into the hair loss industry, I heard very many stories about the devastating effects of hair loss and its psychological toll on the sufferers. The low self-esteem, the lack of career opportunities, the low sexual libido, and lack of intimacy. These are not minor issues. These are quite significant issues for some of the people that are going through this. So when I sit in my consulting room, across the table from a lady who walks in and has to take off her wig to expose her baldness, or a man who is bald to such an extent that it affects his demeanor and confidence, then I think we were justified to establish this business in Africa. There is just such a need for it. Only just this week of this conference, I received a very distressing email from a potential client who is 22 years old, described himself as a victim of baldness, depression, and low self-esteem, all because of his receding hairline. He was asking for his hope to be revived and his confidence secured. And that really brought it home to me. Now, I've personally consulted with over 2,000 clients that, as Kemi mentioned earlier, over the years, both in Nigeria and in Ghana. And I know that there is always a solution for everybody. And as I keep emphasizing, every time I have the opportunity to go on media to talk about hair loss, the key is early intervention. Early intervention. The earliest you notice a problem and you could come to us, the better the solution you will get, and the cheaper sometimes it will be. So thankfully, it is no longer necessary to shrug off hair loss as inevitable without any solution. We have a wide range of treatments for different types of hair loss. So you're going to hear more detail from my colleagues about different hair restoration techniques during this session. So I'm not going to go into too much detail about the treatments. Suffice to say that on a broad spectrum of treatment options, we have certain medication such as topical minoxidil, finasteride, and supplements for genetic form of hair loss. There are also specific therapies such as platelet-rich plasma, mesotherapy for the treatment of thinning hair. Now, for men who have gone completely bald and prefer the shaved look that gives them a clearly defined hairline and the appearance of hair, we have a revolutionary microscar pigmentation. And finally, at the very end of the spectrum, we offer the gold standard of hair restoration through hair transplant surgery, using both the FUE and the FUT methods of implanting hair follicles. So I hear you asking, you're probably thinking, why should I come to Vinci? That's a good question. Why should you come to Vinci? Well, it's simple. Global expertise available locally where you are, not having to go anywhere else. Your hair loss solution is available right here in Nigeria and in Ghana at a fraction of the cost of going abroad. But most importantly, with the same high standards that of expertise that is available in other countries. And one thing you've also got to bear in mind is we're part of the world's leading specialist hair restoration company. And we offer the same customer experience, staff training, procedures, and international standards as any of our other clinics anywhere in the world, be it in the United States, in Dubai, anywhere in Europe, or even as far away as Australia and Brazil. We are truly the hair loss experts in Africa and place a huge emphasis on successful outcomes for each and every client. Our medical staff are highly trained and are usually sent to our Dubai clinic for several weeks training before they start participating in any of the procedures offered in the clinic. Furthermore, we share best practice with other clinics and colleagues across the world and believe in great customer service, top-notch quality control, and ongoing continuous professional development for our staff. So I would just round up by saying that in the 5 years since we started offering hair transplant procedures in Lagos, we have successfully carried out over 200 transplant surgeries. In addition, we have performed over 1,000 microscar pigmentation and 1,000 platelet-rich plasma procedures to date. That shows us that there is definitely a need for our services in Africa, and we have the expertise to provide the solution. Thank you very much, and I hope you enjoy the rest of the conference.
Thank you so much, Mr. Ayo, for that keynote address. Indeed, there is a solution to everybody's hair loss issues. That was very insightful. And we're so happy. I'm so happy personally to know that this expertise is available locally here on the continent of Africa. Our next speaker is the doctor who invented MSP and the global head, Vinci Hair Clinic, Dr. Salva Beyonce. Salva is one of the world's top hair loss experts. He is certified as a surgical assistant in hair transplants with the International Society of Hair Restoration Surgery and is a senior consultant for Vinci Hair Clinic. He's also the inventor of the MSP, microscalp pigmentation, that a lot of us know about, which is a breakthrough treatment for patients suffering from scalp diseases. Thank you so much for joining us today, Dr. Salva. It's indeed a pleasure to have you. Please go ahead with your speech.
Well, good morning, everyone, and thank you, Kemi, and thank you, Ayo, for the introduction. I'm gonna tell you a little bit about Vinci Hair Clinic and how we got started, and that's gonna take me a little bit back, and I'm gonna tell you a little bit about my hair loss history. which really leads back to how Vinci was founded. So that takes me back to the year of 2006 when Vinci really started. That's the year when I had my first hair transplant. My first hair transplant was done here to fill into all this frontal area here, which I had lost. Now, at the time when I had this, let me see, somebody's telling me that my camera is, can you see me now? Is this visible now?
Yes.
So sorry, a little bit of a technical issue, but anyway, let me go back to my story that I was started with. So back in the year of 1993 is when I had my first hair transplant to recover my hair here in the frontal area. Now, when I started experiencing hair loss, I was only 19 years old. I was still a teenager, and as you can imagine, for somebody so young, it was quite a shock to start going bald this early. You're supposed to have all types of different problems and not really have to deal with hair loss at that age. So when this started affecting me back in the years, my first stop was going to my GP, which is usually the first stop where we go where we have any type of a hair loss issue. So when I went to the GP, I sat down with him like a vulnerable young man with all those issues, with I think a lot of hair loss sufferers that are maybe with us today can relate to. But his advice at the time was, well, you just have to live with it. There is really nothing that can be done. So it was quite of a shock to me because I was hoping that my doctor would be able to assist me, would be able to do something for me, rather than just telling me to live with the problem. And I think in the beginning, I kind of lived with the hair loss issue. But as time went by, my hairline started creeping a little bit further back. The hair loss got worse and worse, and I started looking into more and more options. Now, unfortunately, at the time, I have to think we're going back into the 90s, the options were quite limited, and the information was really quite scarce. It wasn't really that available as it is today. But I spent a lot of time reading, investigating, going into all of the different options, and I ended up in 2006 having my hair transplant. And that was a really, really good experience and one of the best things that I've ever done. So the hair transplant did not only restore my hair, but also restored my self-confidence. And I think this is something that most of our clients relate to. And one thing that I hear almost every client say once they've been to us at Vinci is, I don't know why I didn't do it sooner. I wish that I'd done this years ago. And so I would say to everyone, don't hesitate, go ahead, contact us at Vinci and let us help you, because you will be surprised at how much it can change your life. And Ayo spoke a little bit about this in his speech here a little bit earlier. And I think that's a very common theme, that you see how much it really affects one's self-esteem. So the funny thing was, when I had my hair transplant, it was a big secret. Nobody was supposed to know about my hair transplant. This was something that was quite personal, and I was never meant to tell the world about it. Which is, when I look back, now I'm speaking on events like this, I'm educating people all around the world on hair loss, and I get to travel around the world to our different clinics. So it's quite a change, going from being somebody that was suffering from hair loss, shy about it, into now speaking to thousands of people about hair loss every single year. So this was really the base that Vinci Hair Clinic was started on. We were there for the client, and I think the difference between us and a lot of different clinics around the world is everything is based around the client. Every hair loss sufferer is different. There are different reasons for hair loss, and there are different suitable treatments. So at Vinci, we come with a lot of different treatments. We got the microscalp pigmentation, we got the different products, we got the injectable treatments, hair transplants, and etc. And there's not really many clinics around the world that can offer that. And there's certainly not many clinics that are in as many locations as we are here at Vinci. So when we started back in 2006, we started with 2 clinics worldwide, one in Malaga in Spain and one in Harley Street in London, where our headquarters are based. For those who don't know Harley Street, it's been the center of medical excellence for over 100 years. And people from all around the world have come to Harley Street to seek assistance. And that was sort of a strategical placement, because we wanted to be where we could not only help the most amount of people, but we would also have the best access to the best professionals around the world. And that's what we've tried to do ever since. And we try to offer the very best services. Doesn't matter if you're in London, you're in Sao Paulo, in Brazil, where I'm sitting right now, in Africa. All of our clinics offer the same standards of services. But when we started, at that time, it was really only hair transplants. And it was only really one type of hair transplants, which is the FUT technique, where we take a strip of tissue from the back and implant into the recipient area. There was still, at this time, there was still a few clinics doing what we call the old plug grafts, or sort of a doll's hair, where we put big chunks of hair. We've never done that surgery. This is not a surgery that's practiced anymore. And today's hair transplants are quite natural. You can't really notice that somebody's had a hair transplant if you see a patient today that's had it done. So when we started, what was quite shocking is that we realized that not everybody was a good candidate for a hair transplant. And this is where it's very important for people to get in touch and get really evaluated. It's not often as simple as people think. Hair transplants, for example, are based around your donor area. Your donor area is typically the back and the sides of the scalp. And in order to be able to do a good hair transplant, you need to have a suitable donor area that can cover the balding or what we call the recipient area. So we developed a lot of non-surgical techniques, the mesotherapy, PRP, that we offer in all of our clinics today. And when the demand sort of started increasing, we started noticing more and more people that some of them were not suitable for hair transplant surgery. And this is where we came up with the microscalp pigmentation, or the MSP, which is a technique we're very proud to have pioneered. This is a medical grade pigment implanted into the scalp. And this can create either a shaped look of hair. It can also be used for people with longer hair. It can cover scars. And we can do different things like that. So taking you back around this, what's changed? Well, a lot of things have changed. The FUE, which Ayo mentioned when he was talking about the services we offer in West Africa, the FUE has changed the market quite a lot. This is a different technique where we take hair follicles from the back, one by one, using a small surgical punch. Now, this doesn't leave a linear scar, which is quite appealing for a lot of clients. And a little bit about how we manage to offer those services in so many places, how we manage to be able to open so many clinics. We have what we call the Vinci Academy, and the Vinci Academy is a very unique training program that we have, where we train hair loss consultants, we train surgeons, MSP and hair transplant technician. And I think this is one of the things that allows us to really be apart from the rest of the market, because we are able to share this incredible experience from all around the world with different professionals. We treat so many people and we get so many problems solved, and the thousands of clients that seek us. And it's a very, very fulfilling experience for me and for our team to be able to do that. So today we are in more than 14 countries. We're across 6 continents. And we treat thousands, tens of thousands of clients actually every single year. So again, what I would say is for all our clients, all those interested in coming to see us, come to us at Vinci Hair Clinics and allow us to really help you with a personalized advice, because the biggest regret is really not taking action any sooner.
Thank you very much, Dr. Salva Beyonce, for sharing your story. Vinci Hair Clinic started with 2 clinics, and now a couple of years after, you have over 40 clinics across 6 continents. That is huge, if I may say so myself. We have a couple of questions in the question box for Mr. Ayo and Dr. Salva, so we hope you're ready for our questions. The first one says that, okay, just a minute. Okay, the first one says, greetings. If you don't have enough healthy follicles on your scalp, for a transplant? So I'm going to direct this question at Dr. Salva, also because you've had an experience with hair transplant surgery personally. So if you don't have enough healthy follicles on your scalp for a transplant, which means that the baldness is too extensive, can follicles be successfully transplanted from other parts of your body? Dr. Salva, please, can you take that question?
Thank you very much. That's a great question. Again, this is always going to depend on one person to the next, but the short version of the answer is yes. We can transplant hairs from other parts of the body as long as they are a suitable donor area. We can take from chest hair can be used. We sometimes take from the beard, and that's very often done here from the sort of a neck area, where most people, even like myself, which have beard, we usually shave it off anyway, so it doesn't really hurt us to get rid of it. It actually makes our day a little bit easier. But yes, we can, with a very small surgical punch, we can extract one follicle at a time, either from the beard or usually from the chest. It's possible to use other areas of the body, but that would have to be looked at in a specific consultation.
Okay, great. So we definitely answered the question for that person. Mr. Ayo, I'll direct the next question to you. This person says that I've been treating my daughter of 10 years for about 2 years now on hair loss. I took her to different hospitals, but just discovered 6 months ago that it is alopecia. I really need help for her. Did you get that question, sir? Okay, sorry, you need to unmute. I'm going to unmute you now. You're muted. Okay, great. We can hear you.
Yeah, I did. I heard you. It's unusual for a child that young, to be suffering from alopecia. Obviously, she's been to the hospital and she's had a consultation with a medical practitioner. I can't, hazard a guess as to what might have led, to the hair loss. Suffice to say that, for a child, it could actually be a scalp infection that might have caused the hair loss in the first place. So if the scalp infection is actually treated and the infection clears, there's absolutely no reason why hair can't start growing in that part of the scalp. But apart from that, or maybe there are other medical conditions that we're not aware of that have led to the hair loss. But apart from that, it is very unusual for a child that age, to be suffering from alopecia.
Great, thank you. Ladies and gentlemen, don't forget that if you have questions, please drop your questions using the question tab below. And if you have comments in general, you can use the chat box. We have more questions for you, Dr. Salva and Mr. Ayo. This one says, okay, so we have a lot of questions. I hope we'll be able to take them all. This one says that how do you explain baldness in all the sons of a man who had a full head of hair all through his life? Mr. Ayo, would you mind taking that?
It's funny. The reason why I'm laughing is because I've been asked that question so many times. The thing about androgenic alopecia, and which someone would agree with Mondays, there's still a lot to be learned about this particular type of alopecia. And it's not uncommon to find a family unit of a father and maybe 4 sons. The father might have a full head of hair, and then maybe 1 or 2 of the sons might start having hair loss issues. And the usual question would be, the father would turn around to us, are you sure you're my sons? That's the thing about this particular type of alopecia. It can actually skip generations. So once you start looking back in that family history, you probably discover that the grandparents had an issue with hair loss, and the father just happened to be fortunate enough not to lose the hair, but unfortunately it's passed on the genes to his sons, or some of his sons. Yeah, so that's a simple answer to that.
That was insightful. Dr. Salva, we have a question for you. So this person says that, what is the effect of hair transplant surgery on a man's libido?
Well, the hair transplant doesn't affect him physically, but what it does affect is like I told you a little bit about in my own story. It will really boost your self-confidence in most cases if you're suffering from intimacy issues or or you basically are not happy with your look. So from a medical point, the hair transplant doesn't affect your libido, but it does affect your mind and how you feel. And as we know, the brain is the most powerful sex organ for our body. So when you feel good and you look good, you are probably going to feel a lot more better about yourself within the four walls of the bedroom.
So it's definitely safe to say that when you do a hair transplant surgery or you have a hair restoration procedure, it will boost your libido and your ability to approach women and then your sex life in general.
I think that's safe to say, yeah.
Thank you for that. Okay, so we're going to take I can see so many questions here. We have over 12 questions. Unfortunately, we will not be able to take all of these questions during this session. But ladies and gentlemen, please be rest assured that we have a panel discussion coming up in the next few minutes. And we have 4 hair loss and hair care experts who will be sharing, their experience and different tips that you need to know. So we'll definitely take your questions in that segment. I'm going to take just 2 more questions. Which one should I take? Okay, so this person says that I have 2 bald spots on my edges. Mr. Aya, this question is for you. I have 2 bald spots on my edges. Done a great deal to fix it, to no avail. A scan shows the hair follicles are dead. Any hope? And then this person adds and says, I take supplements too. Over to you.
Sorry, is that for me or for Sava?
For you, Mr. Ayo.
Oh, okay. Well, I mean, I'm sure, the panelists coming up will talk a little bit more about hair transplants. But, I mean, once your follicles have died, there is nothing that's going to bring those follicles back except to have a hair transplant. No amount of cream or medication would actually bring those follicles back. So my advice to the person really is, there's really no need or reason to spend more money buying medication. You really need to try and get a hair transplant surgery carried out.
Okay, great. Dr. Salva, I'm aware that you have a book on hair loss. Can you tell us a bit about it and where people can get this book, especially those in Africa, in Nigeria, in Ghana, and other parts of Africa?
Well, yeah, thank you for that. Back in 2012, I wrote a short book, Hair Today, Gone Tomorrow. And this was a book that was based both on my personal experience, how I went through hair loss, and I also go through the different options on the market and wrote this in sort of a very simple manner for everybody to understand the different treatment option. The book is available on Amazon, so you should be able to read that from anywhere in the world. So if you go onto Amazon, you will find the book there if you search for my name. I am actually writing a second version because since 2012 a lot of things have changed. So I hope that I can present that to you in a few months' time.
Well, thank you very much for that. It was great having you on this session. That will be all that we can take. We have so many more questions, but like I said earlier, we will take your questions during the panel discussion, the Q&A session for the panel discussion. Now, moving on, we are going to watch a very short video on hair loss facts, just to educate us and get us prepped up for our next session, which is the panel discussion. Please, can we have the video?
A full head of hair contains about 110,000 hair follicles. 1 in 2 men will experience hair loss in their lifetime. 1 in 4 women will suffer from hair loss and thinning of hair. 65% of men have visible hair loss by the age of 60. 40% of women have visible hair loss by age 40. 1/3 of women of African descent have traction alopecia. 90% of men say that their number 1 concern is hair loss. 64% of women suffer low self-esteem because of hair loss. 30% of hair loss sufferers would give up sex if it means they will get their hair back. 52% of women have intimacy issues due to hair loss. On average, about 90% of transplanted follicles will grow. Vinci Hair Clinic opened in Africa in September 2014. And to date, they have performed over 200 hair transplants, over 1,000 microscalp pigmentations, over 1,000 platelet-rich plasma therapies. When will you come visit us?
Thank you for sharing that. Moving on now to one of the most exciting parts of today's conference, our panel discussion. One of the things that Vinci Hair Clinic Africa prides itself in is its commitment to awareness and support for individuals living with hair loss in Africa. Now, today's panelists are one of the best hair loss and hair care experts on this part of the continent, and it's my utmost pleasure to moderate and ask them pertinent questions this morning. Our first panelist is Dr. Tunde Adeife. Dr. Tunde Adeife is a hair transplant surgeon and consultant at Vinci Hair Clinic, Nigeria and Ghana. He joined the Vinci team in May 2017 and was mentored by Dr. Riyad Rumi, one of the world's leading hair restoration experts. Dr. Tunde Adeife is the only certified hair transplant surgeon in Nigeria and among the few in Africa. Thank you so much for joining us, Dr. Tunde Adeife. It's such a pleasure to have you on this panel discussion. To our next panelist, Sabina Zell. Sabina is a senior microscalp pigmentation technician and a senior Vinci MSP trainer from the UK. She is based at Vinci Hair Clinic in both Manchester and Bristol. With over 10 years previous experience as a makeup artist manager and permanent makeup technician, she has a precise hand and artistic eye, which allows her to produce the best possible MSP result. Thank you so much for joining us, Sabina. It's such a pleasure to have you here. Our third panelist is Kemi Lewis. She is a lawyer and chartered secretary turned natural hairstylist and entrepreneur. In response to the growing need for skilled and knowledgeable stylists to cater to an expanding natural hair community here in Lagos, Nigeria, she pioneered the first all-natural hair salon, KLS Natural Beauty Bar, in August 2013, which caters to the treatment, maintenance, nurturing, and styling of natural hair of all textures. Thank you for joining us, Kemi. It's a pleasure to have you here. Now, our final panelist is Matthew Ola. He has over 28 years experience in the barbering industry and is the founder and CEO of Posh Hair Tune Barbering Supplies. He's also the founder and former president of the Ghana Association of Barbers and Barbering Salon Owners, GAPSO. My first question will be directed at Sabina, so I'm going to very quickly unmute you. Can you hear, please? Okay. Hi, Sabina.
Hello. Hi, everyone.
Great to have you here. My first question is going to be directed at you. So I'm going to ask you, what is the difference between an MSP and a hair transplant?
So there are many reasons why you would decide to go for MSP instead of hair transplant. Basically, I would say the first one and the main one is your lifestyle and maintenance. With MSP, it's definitely easy because it's very low maintenance. All you need to do basically for a shaved look is shave it every day and keep your head moisturized. That's the first thing ever. Second reason also, your hair loss might be too advanced. So your surgeon would say, you're not suitable for hair transplant because you would not achieve the results you're looking for. In that case, this is definitely the best solution for you. MSP is also, you do get results within a month. So you usually would have 3 sessions and that would achieve your final look, which is a bit quicker than a hair transplant. So that is a reason to go for MSP as well. We often use it as well to make your hair look thicker. So this is what mostly ladies go for. This is called density MSP, and we would work between your hair to create like a fuller look. Basically, it's not replacing hair, but it's making scalp less visible, and it achieves a bit more denser look as well. Another reason I think why MSP is good for, it's a very safe procedure. So you don't need any local anesthesia, you don't need any surgical treatment or aftercare. Like I said, it's basically done within a month, and a lot of our clients like that. It's also suitable, like I said before, for ladies, for men. It's no age limitation, so it's definitely something to look into if you're struggling from hair loss and a hair transplant is not an option for you.
Thank you very much for sharing that. We have more questions for you, but I'm going to direct my next question to Dr. Tunde Adeife. Dr. Tunde, we've had a lot of questions in the question box about hair transplant, hair transplant, hair transplant. Tell us a bit about the hair transplant procedure. I think you will need to unmute. So
yeah, I think I've done that right now. Okay.
Yeah.
So thank you for the question, and to answer, the hair transplant, I describe it as a minor surgical procedure. Okay, there is a major surgical procedure, but this is a minor surgical procedure. And the whole idea is to take healthy follicles from a donor area, and then we transplant it or we move it to a bald area or to an area where it is required. Okay, those who are treating baldness will move to a bald area. A person could come and say, I need my eyebrows to be fuller, and we could take hair from a particular area and we move it to that to the eyebrow area or even the beard area. So in summary, the hair transplant, basically, it's a minor surgical procedure which involves removing hair from a donor area and transplanting them to the recipient area.
Great, thank you. And if you have been watching, to our attendees, if you've been watching the different videos that we've played during the course of this conference, we have shown different pictures of what an MSP looks like and what a hair transplant looks like. So I think that we'll play more videos as the event unfolds. Kemi, you pioneered the first natural hair salon in Lagos, Nigeria. That's a huge one. Well done on the great job. So let me ask you, why is having natural hair better? I mean, it's been the trend in recent times. Everybody wants to be on their natural African hair, but I'm sure that there are more benefits than the looks. What are some of the benefits that you can share with us?
Thank you again for having me on. Benefits, typically, I would say that, I would approach it from like two phases. The first is your internal health, because first of all, over years with research and all of that, 3 out of 5 Black women have been found to have tumors, fibroid tumors. And some studies have found this linked to the application of, chemicals, including chemical relaxants. That's one. And then the second thing is, of course, over time, and this comes from a lot of misapplication of relaxers and, overlapping and just too much chemical in the hair. The hair becomes thinner, you have scarring, alopecia, and all of that. So, of course, going natural or returning natural will, first of all, minimize your exposure to these health risks. Number one. Number two, will definitely give you more styling options, because when you have natural hair, you clearly have a whole lot more styling options. You're not limited to always wanting to hide, behind braids and just pack your hair in one. You have, as you progress in life, the older you get, you still will have, a higher probability of having more hair on your head if you stay away from the chemicals, because the more you just keep applying the chemicals, the thinner and thinner the hair goes, over time. So overall, apart from looking at it from a health perspective and internal health perspective, from the physical look of the hair, you will definitely have, better hair health, with better hair practices, because you are not constantly applying chemicals on the hair, and you have, you know, better looks, better styling options, and it's just more beautiful, in my opinion.
Your hair looks gorgeous, by the way. Okay, so maintenance is a big issue. I agree with you. It's safe, is the best. But how do we maintain this head of hair as African women?
You know, when people ask me that question, I always say this. When you want to wash wool, when you want to wash silk, when you want to wash cotton, you will wash them in in different ways. Because most of us grew up with relaxed hair, you know, we all have this perspective of this is the way you handle hair. So because that is what we are also used to, I mean, most of us got relaxes when we were, 8, 9, 10. You know, you now go natural when you're almost 40 after handling relaxed hair for over 3 decades. And then all of a sudden it's like, oh, it's too hard, it's too difficult, I don't know what to do. It is not. You're just looking at it from the, you know, perspective of what you have been doing with relaxed hair. So the first thing that needs to be done is really just changing that mindset to understand that you cannot look at it and you can't treat it the way you were treating relaxed hair, because it's a completely different texture. So you first need to understand, you know, your hair, because the hair has, I mean, so many different characteristics. What is your porosity type? What is your, you know, your hair type, your elasticity? Therefore, you know, once you begin to understand your own hair, you know, it becomes very, very simple to know that, you know, it's just very simple, you know, approach. You know, you will shampoo, you will condition, you will moisturize, you will protect. For me, those are the 4 main things you just need to do. It's a 4-pronged approach. Once you know what, you know, you understand your hair, and it's really just about getting to understand. Too many Black women are afraid of the hair that grows out of their scalp. I don't understand it. I mean, it's coming out of your scalp, but they're always so afraid. What am I supposed to do? I don't know. It's too hard. It's not. It's out of your body. So you just need to understand it, you know, begin to interact with it and love it, and it will thrive, because it's just waiting for you to just, you know, get involved and, you know, it will thrive. And for me, that's just it. Just a change of mindset, keeping it simple, and then just, you know, applying the right products as and when due.
I love that, a change of mindset. We have more questions for you, especially with our Q&A session, but I'm going to go to Sabina. Now, what should an MSP ideally, can I say it looks like a tattoo in some ways? But I mean, I'll leave that to you to clarify. What should one look out for in a quality MSP? Not a lot of people are skilled, you know, at carrying out an MSP. So what should an average person look out for in a quality and well done MSP?
Right, so basically microscalp pigmentation is a medical tattoo. So it is ink placed into your scalp to mimic hair follicles. So I think from the start, it was meant to be like a shaved look for men. That was the prior how MSP was basically sold to clients. However, because we can do many other things, like Salva said before, we can achieve volume, we can work it on ladies, on men. It has many options out there. If you're looking for a good microscalp pigmentation result, let's say, firstly, it has to be undetectable. So ink has to look like your natural hair. It shouldn't be any harsh lines. It shouldn't be visible. It shouldn't be like an awkward hairline. So thank God that fashion is over now. So everyone is requesting a natural hairline. So natural hairline for men. Definitely it has to be the right color, the right density. You always have to research your clinics. If possible, if someone decides to go this route, ask for a consultation with a technician or with a consultant, because it's very important you speak to someone in person, just to let them know what are your wishes, so what are your expectations, and they will, if someone is trained well, like Vinci, for example, we've been pioneers in this procedure and been out there for over 10 years. We will definitely give you an honest reply to what your requests are. And 99% it is doable, because we will meet you halfway. We will give you our recommendations, and with MSP, we can always achieve great results.
Great. And does it fade away? You said it's a medical tattoo. So am I expecting that it's going to be there permanently, or is it going to fade away at some point in time?
Sorry, could you say that again, please?
Does it fade away? It's a medical tattoo.
Right.
So does it mean that over a particular period of time, it would fade away?
Mm-hmm. So the difference between, because it's medical tattoo, it means it's used, we use semi-permanent ink. So once we achieve the full density and the right color that we need, that matches your existing hair, once the treatment is finished, it will definitely last for a while. However, it's how you do your aftercare as well. If you treat your skin well, if you moisturize your skin, the ink will last years. Some clients, some patients prefer it very crisp and quite intense. Those, I would say, they come for a little top up, like between 2, 3, 4 years. But if it's treated well, it does last you 5 and more years. We do recommend to come back in about 5 years to refresh it. Also, sometimes after 5 years, you do want to change your hairline, you do want some differences, some little tweaks, and that's also doable. So it does fade eventually because it's a medical tattoo, but I think it's also for the best. You don't want the same hairline when you're 20 or when you're 50.
Okay, so that's about 5 years on an average.
5 years, yeah.
Thank you. Dr. Tunde, you're the only hair transplant surgeon in Nigeria. And like I said earlier, and when we started this panel discussion, I said one thing that Vinci Hair Clinic is committed to is to ensuring that, we bring experts to answer questions and just to empower and support individuals living with hair loss. Now, when I saw pictures of a hair transplant and procedure at first, it looked very painful. When I saw it looked very painful. So I need to ask you, is it a painful procedure?
All right, thank you for the question. So the hair transplant, like I mentioned before, is a surgical procedure. And the procedure in itself, I like to say, relatively is not painful. I think the only painful bit is the area where we have to introduce the local anesthetic. All right, and that involves injecting the area of the scalp that we'll be working on. Now, in the regular clinic, you must have seen those long needles that are very scary. But in the clinic, we use the very tiny ones that inflict the minimum pain ever. Okay, this is just to help our clients, enjoy the entire process. So this is the only painful bit. And once we inject the anesthetic, that area becomes numb and we can work. I mean, it might intrigue you to know that even during the procedure, some of our clients bring out their phones and they're on Netflix throughout. As a matter of fact, I see my transplant sessions as an interaction session because my nurses can actually confirm this. The clients actually end up gisting with us from the beginning to the end, so it's fun time for us. We are restoring the hair of the client. The client is calm. The client is having her peace, watching movies on Netflix. Some of them actually come with their laptops, and they are doing transactions. We see all of these things. So I'll tell you, relatively, it's not painful. So if you are having this scary thought about it, I think you should drop it. It's not as scary as you think. Apart from that, you will go home the same day. So it's not as scary as you think. Trust me.
Okay, that's good news. The fact that people go home the same day. So does it give immediate results? Am I expecting that if I have a hair transplant procedure done today, by next week, ta-da, I have hair on my head?
All right, so this is a very wrong conception. The hair does not grow immediately. The growth of the hair naturally has a cycle. There's the anagen, there's the cartogen, then there's the telogen phase, okay? And all of these take time. So once you plant the hair goes through a series of adaptations, okay? It goes through the anagen phase, the cartogen phase, the telogen phase, and before you begin to see hair growth, all right, it might take about 6 months before you see the follicles that have been planted coming out, all right? Usually between the time of the transplant and these 6 months, many of the clients keep calling, doctor, what's going on? But we just try to reassure them. The hair is just going through its natural cycle, okay? By 6 months, it begins to grow. It might also interest you that even some people experience results at 4 months, okay, at 4 months, but I don't like raising expectations. So I tell you, from 6 months, you begin to see the follicles sprouting out. So it's not immediate, okay? It might take some time. So you have to exercise a little bit of patience.
Yeah, well, you definitely have a healthy head of hair. One final question for Kemi, because we have over 30 questions from our attendees that we need to get into. Kemi, like I said earlier, I love your style of hair. Another major worry for African women like me is that I'm thinking, aside from packing my hair in a bun, what other hairstyles can I explore? So, I mean, just share with us 2 other hairstyles that we can explore.
Oh, wow.
Natural hairstyles.
Natural hairstyles. That's what I was saying about, the versatility that you get with natural hair. So you could wear 2-strand twists, you can wear flat twists, you can wear natural hair updos, you can wear finger coils, comb coils. I mean, you could twist it and then roll it. You could do strokes. I mean, there's so many different things you could do. You could wear it in an afro. You could wear it stretched out. You could wear it in cornrows. You could wear it in flat twists. You could combine flat twists and natural hair updo. So, because of the texture and the volume and density your natural hair will give you, you have more options. You have, greater versatility with the sort of styles that you can wear, as opposed to with relaxed hair. Most people with relaxed hair, all they will end up doing is packing their hair in one or rolling the hair. Yeah. And then that's it. And then ultimately they're going to get braids or put, a weave or wig. And all of this over time will, even help to thin and dry the hair out. So that's the beauty of natural hair. You don't always have to have extensions as a crutch. You can wear your own hair in so many different styles and make sure it's healthier and more beautiful as time goes on.
Thank you. So now that I know that I have different hair options, I think I need to see you after today's event to discuss what my options are. Okay, so finally, ladies and gentlemen, don't forget that I said that we would love for you to take pictures during the course of today's event, share on your Insta stories, on your WhatsApp stories, on Twitter, using the hashtag Vinci Africa HLAM 2020. I'll take that again, Vinci Africa HLAM 2020. Also, if you're thinking of leading the conference for a short period of time, please do not do that, because we have something exciting to share with you before the end of today's event. So to our questions, I hope our panelists are ready for the questions. Okay, so the first question, I'm going to address the first question to Sabina. This person says that, does diabetes cause hair loss? Sabina, did you guess it?
Okay. Sorry, what was the question?
Okay, so the person says that, does diabetes cause hair loss for individuals with diabetes?
If pigmentation causes hair loss. MSP.
Okay, so Dr. Tunde, do you have any other additional thoughts to share on that?
Okay.
Right. I'm not sure if I heard the question right, but the question was if micropigmentation causes hair loss, the answer is definitely no, because sometimes clients would even say that microscalp pigmentation, with a little gentle needling, it stimulates the follicles, they're still there, and sometimes after that, even more hair comes through. So it's definitely a no. Microscalp pigmentation does not cause hair loss.
All right, then, thank you. So the next question, I'm going to direct that question at Dr. Tunde. This person says that, does diabetes mellitus cause hair loss? Good morning.
All right, so diabetes mellitus, like most of us know, it's a problem where the body cannot metabolize sugar properly. All right, so imagine a condition like this. For any organ in the body, you need blood supply. Now, the supply of blood to any organ is carried by arteries, which you can just imagine like a tube, okay? A tube that has a canal on the inside. Now, diabetes mellitus, there's a lot of sugar in the blood, and unfortunately, this sugar gets into the wall of the arteries, and it makes it to thicken. The summary is that there is a reduced blood supply to different organs. So that is why you notice that even people that have diabetes mellitus, especially those who are not controlling their sugar, they experience issues with the nerves. There will be numbing in some areas. Some of them actually cut their foot and they don't even know that the foot has been cut because the blood supply has been reduced. Okay, the kidneys also have issues because the blood supply has been reduced. The hair at the same time also has issues because blood supply has been reduced to the hair. And so the hair is not getting enough blood supply, it begins to shrink or thin out, and eventually there is a hair loss. So yes, diabetes mellitus, which is characterized by hyperglycemia or high levels of sugar in the blood, can actually cause the follicles to thin out and also to fall off.
All right, thank you. Dr. Tunde, please just stay on there for the next question as well. This person says that, can a cancer patient that has fully recovered undergo hair transplant procedures? And if the patient is still taking medications, I presume cancer medications, would the hair still fall off?
Okay. So can a cancer person actually have a hair transplant? So this actually depends, first and foremost, on the availability of donor hair. Now, the medications and the procedures, radiation, chemotherapy that are being involved in treatment or management of cancer actually causes the hair to fall off. Now, after the treatment and the cancer has been resolved, we need to assess, first and foremost, if this individual has enough donor hair. If there is enough donor hair, then indeed we could consider doing a transplant. But then he also mentioned if you are still taking some medications. If you are still taking chemotherapeutic medications, this could adversely actually affect the hair transplant and it might not be successful if you are still using those medications, because those medications are acting against actively multiplying cells, that's the cancer cells. The hair actually actively grows, so it will affect the hair and it will not make it grow at the pace that you want. So if you are still using the medications, once again, you need to come and we need to discuss which medications are you using, and we need to find out if the side effect of that particular medication is causing the hair to fall off as well.
All right, thank you. I'll direct the next question at Mr. Ayo, because this has to do with the branches. Okay, please, I think you need to unmute. You need to unmute. Yes, so this person says that, greetings, do you have a branch in Abuja? I really need help for my frontal hair loss. I lost my frontal hair after making braids 5 years ago. It's really annoying and embarrassing because I'm ordinarily a hairy person. I have tried several means and spent a lot trying to get back my front hairline to no avail. What can be done about this? And is it affordable for low-income earners like myself?
Okay. The answer to the first question, yes, we do have a clinic in Abuja. So that's the simple one. The second part of our question as to what she can do, having tried so many different treatments, usually with the hair loss which she's suffering, which I suspect is traction alopecia, based on what she said about the braiding. Invariably, if she's used so many different treatments and it hasn't worked, then basically the hair transplant surgery is the only other solution that she can rely on. Well, in terms of affordability, I mean, we normally charge $4,000, for a hair transplant procedure at the clinic. So I guess for the average Nigerian, it's probably on the very expensive side. But then when you think about the amount of resources that goes into actually delivering the procedure, and the fact that we have to import a lot of this from the UK and the US, unfortunately, we can't, as much as we would like to, we can't reduce our prices any lower than what we're charging. In fact, in our UK clinic, we charge double. So sorry, but look, I mean, the main thing is coming to sales, coming to the Abuja clinic. Don't let that put you off. Come in, let's have a look at you. The consultation is free. You don't pay for it. So come in, let's have a look at you, and then we'll take it from there.
Okay, great, thank you. And like I said earlier, you need to stay on for this conference because we have exciting news to share with you before the end of today's event. Still for Mr. Ayo, I think we answered this question. Is your office in Abuja? Yes. What are the financial implications? Okay, I think we answered that already. Sabina, this is for you. Okay. What about scarring from MSP? What is the risk of this? This person is asking about scarring from MSP. Okay, we can't hear you.
Oh, sorry. Hello?
Yes.
Okay, so with MSP procedure, there is absolutely no scarring whatsoever. The needles we use are tiny 3 micro needles, and the needle goes very gently into the skin. It's not as deep as normal tattooing, so there is absolutely no scarring whatsoever. In fact, we do cover scars with microscopic rotation and very effectively as well.
Yeah.
Because sometimes when the scars after hair transplant procedures, it depends on how skin heals actually. So everyone is a bit individual here as well. And like we've heard before, it's always good to come for a personal consultation, but we do cover a lot of old scars. I know my oldest patient was 72 years old, and he had they were done basically when I was born, so 40 years ago, and they covered them amazing. It was very perfect coverage, and we do that very often as well.
Thank you. Kemi, next question is for you. This person says that, can a woman with natural hair experience hair loss?
Oh yes, I mean, even though you have natural hair, there are other different factors that could cause you to have hair loss. It could be postpartum shedding, it could be an underlying health condition, it could be medication that you're taking, it could be, you know, stress related, it could be a thyroid issue, it could be a hormonal imbalance. So there are many different factors that could cause you to, you know, to have, you know, hair loss or thinning hair that have nothing to do with chemicals, that, you know, have everything to do with what is going on the inside. So yes, you know, it is possible.
Thank you for that. Mr.
Yeah.
Ayo, we're back to you.
Yeah.
I'm suffering from alopecia, which makes me use hair extensions always. I've been to your clinic and I was told there was nothing to do and learn to live with it. I am so depressed. The question I have is that, will I live with it for the rest of my life? I'm just 30.
Wow. I'm really amazed that we would have given that that response in a consultation. Just live with it. No, we don't. We won't say that. Like I said, you know, there's always something for everyone. Now, in the past, I've actually consulted with female clients who have what we call alopecia totalis, which is the loss of hair, the total loss of hair on the scalp. And this particularly, there were several of the ladies. There wasn't just one, there were several. I've always used wigs, you know, to cover up this alopecia totalis. And when it came in, I said, well, look, you know, hair transplant is not really an option because, you know, where do we get the follicles from? The extent of the baldness is total. So I suggested microscopic pigmentation, you know, which, you know, I'm sure Sabina would agree with, as a solution. Now, I don't know if you guys have heard about the US representative who has a very similar condition, alopecia totalis. Her name escapes me at the moment, a Black lady. And she came out recently in the last 6 months to 8 months to say that she's suffering from autoimmune disease, which is the cause of the alopecia totalis. And she was totally bald. Now, she looked absolutely beautiful. And I was just thinking that with a bit of scalp pigmentation, I mean, wow, she would have been, she would have been even more remarkable. So there's always a solution. So for the questioner, I would say, please come back to the clinic. Even if you have totalis, we can still do MSP for you. The only thing you need is to just have the confidence to be able to go out there without having to wear wig and be able to, you know, rock the scalp pigmentation that we've done.
All right, thank you for that. Still stay on, Mr. I. This person says that I can't continue finasteride because of its sexual effects. What is the alternative to use with minoxidil?
Right. There is a herbal form derived from the pharmaceutical element within the finasteride. We don't normally prescribe finasteride for women for hormonal reasons, but if and then sometimes we've discovered that a very small percentage of men who are on finasteride might experience low libido or a reduced sex drive. Well, if that's the case, then, you know, maybe you need to look into the alternative, which is saw palmetto, which is, like I said, is the herbal form of finasteride. So you might want to try that out. They do the same thing, you know, which is basically blocking DHT, hydrotestosterone, which is the cause of the genetic form of hair loss.
All right, thank you, Mr. Ayo. Sabina, is it possible for one to revert to hair transplant surgery after undergoing the MSP after some years?
So definitely, again, I would say yes. We have many patients who start with hair transplant and then we go to microscopic pigmentation. So it can be done two ways. For example, if hair transplant wasn't giving them the results they really wanted, so if the hair was still not thick enough and looking dark enough, let's say, ink definitely doubles that effect. So we work on a bit of length between and it can be done. Also the other way around, a lot of times when clients start with microscopic pigmentations, they kind of like the shaved look, if they're, especially if they're a bit sporty, if they're like they live an active life. But after a while they say, you know what, I would prefer a little bit of hair. So again, they would have to go through consultation with a surgeon or our advisors to see how their donor area is. They would let them know if it's doable. And after that, hair is transplanted on the area where micropigmentation was done previously. And again, it gives even better result. It's double the density, not for real, but it's like effect of double density. So it can go both ways, definitely, yes.
All right, thank you. We can only take two more questions, one for Kemi and one for Dr. Tunde. Unfortunately, I know that we have so many questions, but unfortunately, because we still have one more session, one more segment before we call it a day, so we don't really have so much. And so if we didn't take your questions, I'm so sorry. We would send you personal messages to answer your questions. So Kemi, this person says, is natural hair for all hair types? Because my hair seems very thick and I think it will be a huge problem if I ever went natural.
Okay, so that just goes back to, what I started to say, at the beginning, which is, it's really just a mindset thing. It is for, as long as it's growing out of your head, it is your hair. It is meant for you, regardless of.
Hi, Kemi. Okay, we can't really
The
hear.
regimen that you need to create for yourself, how often you're doing the sort of hairstyles you should be doing, so you can do it. People just automatically shut themselves out and say, oh, natural hair is not for me because my hair is thick. Your hair will look absolutely beautiful with natural hair. So it is for everybody, as long as it is growing out of your scalp. It was meant for you.
Our final question goes to Dr. Tunde. The person says that diagnosis of I have a diagnosis of alopecia cicatricata. Apologies if I didn't call that properly. Is there a cure?
Centrifugal.
Okay. Thank you, Mr. Ayer.
Centrifugal cicatricial alopecia. It's a mouthful, sorry.
Okay. The person says, is there a cure and can a hair transplant work, Dr. Tunde?
All right. Centrifugal alopecia or scarring alopecia, basically, it's when you have inflammatory cells that have gotten into the scalp, okay, and essentially a scar is being formed on the scalp. And it's my interest to know that one major reason why this scar forms is the prolonged and excessive use of relaxers. So you might want to lower that the use of relaxers because it can actually cause this scarring alopecia. The question is it possible to do a hair transplant? The scarring alopecia has two forms. There is the active form or the progressive form, and there is the quiet form, okay? So the active form, once you come and we diagnose that the scarring alopecia is in its active form, at this point, we can't do a transplant because the result is practically going to be zero. All right, but if it's the resting form, okay, if it is not active anymore, we again have to assess. Okay, we might do some tests, we might do a biopsy. We also want to know if you have enough donor hair. And with this, we could actually consider. I must tell you honestly, most surgeons feel like we can't do a transplant for scarring alopecia. But honestly, it's a 50-50. Okay, once we can diagnose that it's in the resting phase, okay, then we can consider doing a transplant for this. But again, you need a consultation. Very important.
Yeah.
Thank you very much. Like I said, unfortunately, we couldn't answer all the questions in the question box, but we're going to reach out to each and everyone to send you responses to your questions individually. So thank you to our panelists. for sharing their wealth of knowledge and experience with us. We are indeed very grateful. Thank you, Sabina. Thank you, Kemi. Thank you, Dr. Tunde. Thank you, Mr. Ayo, for your time.
Thank you.
You're welcome.
Thank you very much. Well, so much.
Thank you, everyone. Thanks for having me.
Thank you, Sabina. And bye.
Thank you. Thank you, guys.
Wow, so much has been said. Our hair loss and hair care experts have shared with us best hair care practices, hair loss prevention tips, treatment options, and so much more. But there's a popular saying that goes, seeing is believing. So it's indeed an honor and a great privilege to have right here with us at today's conference clients who have undergone different hair restoration procedures at Vinci Hair Clinic Africa and will be sharing with us their before and after experience. But first, we have Yata, all the way from Liberia, narrate our experience via this video.
Hi, my name is Yata. I'm from Monrovia, Liberia. I'm a sales agent. Actually, my hairline started receding years ago, and it made me so depressed. Actually, I inherited hair loss from my mother. So my hairline started receding years ago, and it made me so depressed, and I was compelled to find a solution to my hair loss problem. After spending so much money on recaps, spending so much money on products that wasn't working, it made me so frustrated that I had to find a solution to my hair loss problem. One day I did a research on Facebook and I found Vinci Hair Clinic, Nigeria, and I booked a consultation with Mr. Ahmed. I wrote them saying I wanted a hair transplant because it was the only solution to my hair loss problem. The process was very easy. They were so helpful, they were so caring, and they were so friendly. Well, Vinci's approach to my treatment was very easy. They answered all my questions and they nurtured and guided me through the entire process. They were very swift and helpful. Since I had my hair transplant, I started seeing results around the 4-month mark, and up to now I'm still seeing results. As you can see, I'm still seeing results. My hair keeps growing every other day. My hair keeps growing. Well, it has helped me feel better about myself. I'm not insecure anymore. Now you can see I'm rocking my natural hair. It has helped me gain my confidence back. So to anyone out there who is suffering from hair loss and you are tired of hiding your hair on a weave, scalps, and cuts, my advice to you is to contact Vinci Hair Clinic Nigeria, and it will be all worth it in due time. Thanks to Dr. Tuna and his staffs. They are the best. You guys changed my life. I love you all.
Yes, Mr. Aya, please go ahead with the panel discussion with Anthony Monjaro and Elvis, who are here with us.
Thank you, Kemi. Thank you. I would like to start by saying that most of our clients do value their privacy, but we have a few brave ones who have stepped up today to participate in the question and answer that I'll be doing very shortly. We've just seen the first. Firstly, we saw the video of the lady from Liberia who had a hair transplant, Yata Morris, and the wonderful story that led her to Vinci Hair Clinic, and the joy that we brought to her life. We also have two young men also here today who will be putting into the hot seat, and you could then interview the two guys. The first of the clients is Elvis Onojego. Sorry, I hope I pronounced your name properly, Elvis. I beg your pardon if I haven't. Elvis had a hair transplant with Vinci Hair Clinic a couple of years ago. And I mean...
Yes,
hello?
sorry, please. Sorry, Mr. Is it okay to tell Elvis, please, do you mind switching your phone? We are literally seeing you upside down.
Oh, no, it's Anthony. Anthony. It's Anthony.
Sorry,
oh, it's me?
Elvis, Anthony.
Oh,
yes.
okay.
Yes.
All right. How's that?
Oh,
that's
fantastic.
better. That's better. Thank you very much. Thank you.
Okay.
So we've got Elvis, who had a transplant with Vinci Hair Clinic a couple of years ago, and has kindly agreed to come and share his story with us and to answer some of the questions you may have. And we also have the honor of having Anthony Monjaro, who some of you would have heard of. He's a famous Nollywood actor. And, you know, I'm sure you would have seen one of his movies, which is The Last Flight to Abuja. From Abuja, sorry.
To Abuja.
So, to Abuja, sorry. To Abuja, well done. Thank you very much. So thank you, Elvis, and thank you, Anthony. So I've got some questions, actually, which I want to start off. And I think I'll start off with Elvis. So how long were you bald for, and how did it make you feel? I mean, you know, before you came to Vinci Hair Clinic.
Okay, thank you, Mr. Ayo. I think my late 30s, I started noticing that my hair was going thinner, you know, right from the crown area, and it was coming forward, you know. So then I didn't really bother, you know, I was always cutting my hair. You cut the sides, you know, so the top is kind of higher. Then I started, you know, feeling uncomfortable that, man, I'm still young. Why should I start, you know, carrying? But I had to. It got to a stage I was really bringing the hair down, you know, and I just got very uncomfortable. And I started to search on my own what I do, you know. So I was actually talking to a company in Turkey, you know, to go do a transplant. They told me I can do a transplant. In fact, they just told me straight from the start that I should come for a transplant. So along the line, I said, let me just search. You know, I don't know how I came. I can't remember how I really came out at Vinci. I think maybe there was a pop-up or something. And I started to read. I said, this is Ikoyi, just right here. I said, okay, I will just go and, you know, try and do a consultation. Well, let me just see what it is. Fortunately for me, I came and I saw you, and you were very nice, you know, very warm. And I will tell you a secret, you know, I discovered it was half the price to do it in Turkey. I'm not talking about my tickets. So I said, I'm sure these guys are not going to take off my head along the line. So, but, you know, everybody was nice. Tunde was very nice. Everybody was encouraging me, just do it like this. I started asking, what are the negatives? You know, what can go wrong? And I looked at it. I said, well, let me just give it a try. My wife was, man, are you sure about this? I said, let's just try it, you know, because I'm somebody that if I want to do something, if I don't get it on, you know, I become restless. So I tried it, and I'm sure you can see my hair.
Yes,
you know, so
yes.
That's it.
Okay, thank you, Elvis, thank you. So, Mr. Monjaro, what was the defining moment when you decided to do something about your baldness?
Can you hear me?
Yes, I can hear you. I said, what was the defining moment when you decided to do something?
Yeah. Well, see, as at 8 years ago, when I actually shot Last Flight last flight to Abuja, I see her hairline. But kind of, then all of a sudden, it started disappearing. And you don't notice these things. But I mean, from the full afro I had before to low cut and then to the hairline was okay. I was okay with the skin cut and everything. But after a while, it just disappeared. And my dad said I'll get used to it. I should just kind of live with it. And I did. And a friend of mine sent me a link to the MSP procedure. Okay. And I started my research on that. And then one thing led to another. I said, okay, I'm going to do it, but I'll do it in the UK. Okay. Now, I don't know how I found Vinci Hair Clinic. I think it was probably through I saw your video on their main site, on the UK one. Okay. And I saw it in Nigeria. You mentioned about the one in Ikoyi. Yes. Checked it out. Went in for a consultation. Spoke with Tunde, and I was convinced. I said, you know what? Because I'm constantly in front of the camera, so I couldn't afford for this thing to go wrong. But after speaking to Tunde and everything, I knew definitely I want to do it here. And after the first one, because what they normally do is it's a thin outline first, so you actually just see what it looks like before you do the second one and then the final one, which actually gives you the full one. And my brother, I am rocking this hair every day. Wonderful. Everybody actually say, "What happened to your hair?" I said, "I don't know. I don't know."
Yeah. Wonderful, wonderful. Then there's actually one follow-up question I would like to ask you, Anthony. I mean, what made you opt for the treatment you went for in the end? I mean, because you had the option of a hair transplant. So
yes, but yeah, I mean, I'm used to the skin cut, and the only difference was that I didn't have that defining thing. Listen, there's a big difference. Yeah. There's a big difference with the hairline and no hairline.
Absolutely.
And when I put when the hairline came back on, there, like I said, it's like night and day. So I'm quite happy with my own hair being like this. It's low maintenance. I don't have to stress myself too much. I am good with this. For me, this is perfect.
Absolutely. Join the club. I've had the same thing done. I love shaved look. I love shaved look.
Me as well.
Absolutely. So Elvis, I mean, you shared some of the concerns you had. I mean, when you were initially going to go to Turkey to have this done, and then you discovered that, hey, Vinci, in Ikoyi, you could get it done. So what was your biggest concern before you came into us for your treatment?
Well, my biggest concern was, why this is Nigeria. So I just wanted to be sure that you guys can handle it. I don't want to go into something and start dealing with some other issues. It's as if I took a gun and shot myself. So that was actually my biggest concern. So I did a lot of reading. I checked out a lot of things on websites. Then, especially when I met you, I was comfortable because you started to explain some things or some terms I didn't know what it meant. You started explaining those things to me, what it meant, what this meant, what this can be done. So you told me, and I was convinced. I don't know, maybe. Yeah, I don't know. I was just convinced that you guys can handle it. And when I met Tunde as well, and a couple of his colleagues, the nurses, they were showing me a lot of things and telling me, and so I said, okay, I'll give it a try. Of course, I prayed, and I took the risk.
Just as a backup, just as a backup.
Can I just add as well?
Yeah, sure.
Yes.
Sure, Anthony. Please go ahead.
Yes. I share the same fear as well, where I didn't know if it would go right or not. I actually spoke with Tunde. I actually requested to see the artist that was going to do the procedure and all that. And for me, it was easy because if anything goes wrong or I'm not happy, the clinic is Nigeria. I'm in Nigeria. I live in Nigeria now. So it's easy for me to just go and access that instead of having to fly back again to the UK and say, hang on, this is not right, this is not right. I need to fix this. And all. So it's much more easier for me to access someone who's in Nigeria here than actually flying out. And I must add, we have some of the best practitioners in Nigeria here, regardless of the fact that most of us have actually left, but we still have great practitioners, not just in your field, but in other fields as well. And I'm big on made in Nigeria and people actually doing things in Nigeria here. I don't think we give ourselves enough credit.
I totally agree with you. And thank you very much for that. Thank you, Elvis. Thank you. Thank you very much. So, I mean, can I ask you, Anthony, what impact has the treatment had on your life? I mean, you are a public figure.
What impact? I did the final one on the 10th of July. Today is the 22nd of August. So it's been less than 2 months. Okay. And in that period, there's been a massive difference. I can't wait for films that have actually done with actually the procedure on, because even looking at the screens after we've shot the screen for it before it comes out, I'm seeing a massive difference in how I look as well. I'm looking and feeling younger. I mean, I was confident before, but now I'm way up there in confidence.
Wonderful, wonderful.
Yeah.
Wonderful. So my final question to you, Elvis, I mean, what advice would you give anyone who is in your position? What advice would you give them?
Well, like everybody says, seeing is believing, So what I will advise is just the bold step up, and they will counsel you. There are many options that you can do. I chose to do the transplants, because I wanted a hair back, Sure. You can see Anthony's looking sharp, Of course, I know, I was sure it was the Anthony that was going to come on, but now, this is the monster, So
I'm at a wedding, by the way. I'm a wedding right now.
So, so I would actually advise that just step up, go to the clinic. They will give you all the options, what you can do, check on your health status, all the things that your fears. Let them know, because you don't have to be bald unless you just want to be bald,
Well, it's a
there are
choice,
so many
preference.
they tell you can use hair, use that cream. I did all that. I was using all manner of herbs and cream and some native ones. It doesn't work. It didn't work for me. I don't know if it works for other people, but it didn't work for me.
No, it doesn't work.
But
doesn't work.
My hair is grown. I cut my hair like once in a month, so that the shape is there.
Yeah.
And I'm very, very confident that
Wonderful. Thank you very much, guys. Thank you, Anthony. Thank you, Elvis. I mean, thank you for sharing your story, your experience with the conference. Thank you very much for coming along. Kemi, over to you.
Welcome.
We can't hear you.
All right, that was incisive. I hope you enjoyed that session as much as I did. I loved every bit of information Anthony and Elvis shared. Thank you very much once again. We have something to share with you in the next couple of minutes. I'm sure you don't want to miss it. If you know anyone who was here at the beginning of the conference and stepped out, this is the time you need to tell them to come back. This good news must not pass them by, as my Nigerians will say. Just before I share the good news, Kate Akwaflo will be sharing something equally important with us. Kate is the founder of Natural Treats Industries, a company committed to manufacturing natural hair and skin products that fulfill a promise of wholesome and effective natural goodness. They have a range of hair products and shea-based body butters, and in the spirit of fair trade, a percentage of Natural Treats profit goes to support women of the T-Bomb Share Processing Group. Kate, over to you.
Hi, everyone.
Hi, Kate.
I'm Kate, as she said. Yes, and then today I'm just here to speak a little bit about share and how it will be beneficial to African hair. So permit me to begin sharing my screen because I have a very short slideshow. Okay. So, yeah, so the question is, why is shea butter good for African hair, or how important is it? So shea butter is actually key for African hair because African hair structure is different. It's different from other types of probably more straight hair types. So our hair grows in a helix shape, so it makes it denser and more prone to dryness because oils do not move along the shaft as easily as it should. And then the way our hair follicles are curved is also different. So it makes it easier for the hair to not entangle. So when you are caring for your hair, whether before a procedure or after a procedure, the priority is basically stimulating your follicles, keeping them happy, and then minimizing breakage and tangling. So basically that's what it's about. And shea butter is actually your best bet for this because it reduces inflammation and irritation of any kind on your skin, your hair. And then also it aids penetration of other topical hair treatments. So if you're using something else on your hair or you're giving something to apply topically, when you are using a shea butter cream, it helps whatever it is they're using act better or penetrates your scalp easily. And so what makes up shea butter actually is the building blocks of our hair follicles. So oleic acid is found in very high percentage in shea butter. And that is actually what makes up our hair follicles. So you see that shea is the best thing for African hair. As you can see on your screen, there are many things that the things that make up shea butter do for your hair. It will help your hair be less prone to breakage because it will moisturize it. And then it will prevent it from losing moisture. It's also high in vitamins A, E, and F. And these are antioxidant vitamins, among other things they do. So it helps your skin cells rejuvenate themselves easily, or it makes it more easier for whatever it is that you are doing at the Vinci Hair Clinic to work when you're using shea on your hair.
Yeah.
Now, there's shea everywhere. Why should you buy from Natural Treats and not any other place? We believe that the bounties of nature are not reserved for some few. Why deprive yourself? Why should you make yourself go through using petrochemicals and dangerous stuff on your hair when there is nature available for you? It's not reserved for some people or a certain class. It's for everyone. And our products are multi-purpose. When you buy a jar of our butter, for example, you can use it for massage at the end of a busy day. You can use it on your nostrils when you have a cold. It's so useful for so many other things. So you're getting actually a great value for your money. And then it's safe. There is nothing harmful in it. Actually, shea is edible. So you see that you're having something that you can eat and you can use on your skin as well. It helps with itchy scalp and so many other things that are usual complaints and issues that we have with our hair. With our products, it has been specially formulated and crafted to help with these things. And also our lemongrass range is practically aromatherapy in a jar. You see, research has shown that lemongrass helps lift the mood. So when you're feeling down or you're not seeing the kind of results you think you should see, it might affect your mood. When you open a jar of our butter, you'll feel better. But most importantly, at Natural Treats Luxury, we believe that those who are most deserving of our corporate social responsibility are the hardworking rural women who actually handpick these nuts, wash them, they care for them, they take good care of the nuts and process this butter into what we all enjoy. We believe that they should be most deserving of any social corporate responsibility we have. So when you purchase from us, you are helping support these women. They have taken their lives into their own hands. They're not waiting to be fended for or fed. They've put themselves together into a cooperative or a group, and then they produce this share that we all enjoy. So when you buy from us, you are indirectly or directly you are supporting these women to make life happen, to take their children to school. So that's one good reason why you should buy from Natural Treats. And you can contact us. Please follow us on Instagram at Natural Treats GH. And then on Facebook, Natural Treats Industries. You can send us an email, you can WhatsApp or call any of the numbers on the screen if you need to ask any other questions, if you need to purchase our share, if you want to be a distributor, we are available to answer all your questions. I hope you've enjoyed this very short presentation, and I'll be on standby for any other questions. Thank you.
Thank you. Fantastic, Kate. Thank you for partnering and supporting Vinci Hair Clinic for this first ever Africa Hair Loss Conference. Now, the moment we have all been waiting for, drum rolls. To all attendees of today's conference, we are pleased and so excited to announce that in addition to free consultations, we will be giving you a 20% discount off hair restoration procedures at any of our clinics. Lagos, Abuja, and Accra, a whooping 20% discount. I mean, mind-blowing, if I may say so. Now, simply use the discount code #VinciHLAM. So when you go to any of our clinics, just use the discount code VinciHLAM, and you will definitely be attended to. And that is not all. Courtesy Natural Treats and Vinci Hair Clinic, you'd also be getting a goodie bag when you go to any of our clinics to redeem your 20% discount. So hurry, our clinics are open from Mondays to Fridays. And you should also follow us on social media. We're on Facebook, we're on Instagram, Twitter, and LinkedIn. At this point, I would like to invite once again Mr. Ayo Otubanjo for the vote of thanks.
Wonderful, wonderful. Thank you very much, Kemi, and thank you for moderating this this first ever conference. You've really shown us a totally different platform in terms of hosting conferences. This is my first one, and I've really enjoyed myself. I hope everyone has enjoyed themselves. Obviously, we thank everybody that's attended. I know you've taken time out, from your busy day, to come and listen to all the speakers. We thank all the speakers, all the panelists. We thank Dr. Sava. We thank Sabina from the UK. We thank Kemi for this wonderful thing about natural hair. That was very educational for me, Kemi. Thank you very much. And today, I mean, as ever, your league of female fans online is growing by the day. So thank you to the panelists. Now, thank you to Elvis for agreeing to share, Elvis and Anthony for agreeing to share their stories of the experience at Vinci Hair Clinic. Now, whilst I'll thank everyone that's participated today, we must never forget that a lot of work have gone in at the back end to make this conference a success, to make it what it is. And it will be remiss of me if I don't specifically mention people that have contributed hugely, to the success of this conference. My first thanks is to Kemi. Kemi was the one that actually brought the idea of the International Global Hair Loss Awareness Month, and the fact that we might like to have a conference. So that idea was Kemi, and I really appreciate you, and thank you very much for all the help and the work that you've done over the last month. Tosin Otumbanjo, who is our PR and marketing director, has also been very involved. I mean, perhaps she was the one that's actually pulled all the strings together to make this a success. All the different people that worked on it, she's the one that's actually pulled everybody together. And we thank you very much for your hard work in making this a success. And then, we've got Folorunsho Moyegun, who is our social media manager within Vinci, who's worked tirelessly and in fact has been responsible for a lot of the videos and a lot of the presentation that you sent today. So thank you, Folorunsho. I know Folorunsho has stayed up till 5 o'clock in the morning on some days, working away on this. I mean, a lot of work has gone into this, a lot of work. And I thank you all from the bottom of my heart. I thank you, and God bless you all. So we look forward to having another one next year, because I mean, from the success that we've enjoyed this year, I don't see why we should not, replicate this next year. So I look forward to working with you again for next year, International Hair Loss Awareness Month. So thank you all, and I wish you a wonderful weekend, and I hope to see you all very soon. Thank you.
Thank you all so much for making history with us. This particular conference is the first ever Africa's Global Hair Loss Conference, proudly organized by Vinci Hair Clinic Nigeria and Ghana. See you all at our clinics in Lagos, Abuja, and Accra. My name is Kemi Olawoye. Enjoy the rest of your day. Bye-bye.